We have many, many more people now struggling with addictions to things like online pornography, online shopping, social media, video games, you name it. But not only are we seeing increased rates of addiction, we're seeing increased rates of anxiety, depression, suicide. And one of the things that I think is incredibly powerful is if you look at countries around the world and their rates of depression, anxiety, and suicide, it is very clear that the richest countries have the highest rates and the fastest growing rates of depression, anxiety, and suicide. The reason that we're all growing in our misery is because we're constantly bombarding our reward pathway with highly reinforcing drugs and behaviors. We've drugified almost every aspect of our existence. And the result is that we're walking around in a dopamine deficit state, experiencing the universal symptoms of withdrawal, needing more pleasure to feel any pleasure at all, and feeling injury at the slightest bit of discomfort. So what can we do about it? What I have come to do in my psychiatric practice, whether the individual is coming in with addiction or whether they're coming in with anxiety and depression, the first thing that I will do is screen them for compulsive overconsumption of highly reinforcing drugs and behaviors and suggest to them an experiment. And the experiment goes like this. Try giving up this drug of choice for a month. Why? Because in doing so, you will allow enough time for the neuroadaptation gremlins on the pain side of your balance to hop off and for homeostasis to be restored. And only then will you be able to get joy in more modest rewards. And only then will you be able to see true cause and effect, which is that compulsive overconsumption of these drugs is actually causing your depression and anxiety. What do I do for pornography? I say no watching pornography, but also no orgasms with yourself or anybody else for a month, right? As a way to, again, reset reward pathways. And resetting reward pathways is key to be able to have the cognitive and emotional strength to do what's next, which is decide next steps. Am I going to go back to using this drug? Or am I going to continue to abstain? And either way, how am I going to do that? And then we talk about self-binding strategies. And what do I mean by that? Self-binding strategies are barriers, both literal and metacognitive, that we can put in place to put the brakes on desire. And they are absolutely fundamental in a world in which we're being constantly tempted to indulge. Self-binding means things like not keeping your drug in your house or not keeping your drug in your room, or making sure if you're going to use in moderation, you only use on special occasions and then don't populate your calendar with a special occasion every night. I have a young man addicted to video games, and he came up with a bunch of great self-binding strategies. One of them was that he was going to have one laptop for video games and one laptop for schoolwork. And that way he had a state-dependent learning, that he didn't mix the two. He decided there were certain video games he couldn't play at all, like League of Legends, because once he started, he couldn't stop. He committed to playing only 2 hours a day, only 2 days a week, so he used time as a self-limiting strategy, and he committed to playing only with friends, never with strangers, and thereby made his recreational use of video games something that could extend into positive use. Finally, in the last minute, I want to talk about one other strategy, which is very counterintuitive and paradoxical, but this really works, and it gets back to the balance. It turns out that those gremlins are agnostic to whatever the initial stimulus is. So if we press on the pleasure side by ingesting intoxicants in any form, those gremlins will hop on the pain side to try to bring us level again, tilting us to pain, and then hopefully back to homeostasis. But if we press intentionally on the pain side in mild to moderate doses, guess what? Those gremlins hop on the pleasure side. And with iterative repetition, we'll eventually reset our pleasure-pain balance to the side of pleasure. This is the science of hormesis. Hormesis is Greek for to set in motion, and what we're essentially doing there is using mild to moderate noxious stimuli to trigger our body's own healing mechanisms by upregulating dopamine and other feel-good hormones and neurotransmitters in response to these minor toxins or injuries. So when patients are trying to abstain for those 30 days and struggling in the moment, a lot of times we think, well, if you're uncomfortable, do something to make yourself comfortable. If you're trying to quit eating sugar, go binge on Netflix instead. But what I say to my patients is, there's a big risk of cross-addiction. If you give up one drug and replace it with another, you may get addicted to that other drug. But how about instead of, when you're feeling craving, reaching for another drug, do something that's harder or more uncomfortable or more painful than the pain that you're feeling in the moment, like exercising, like an ice-cold water bath, like making any effortful engagement that forces you to press a little bit on the pain side of the balance.